Do you both attend at the same time, and how long do sessions last? Well, my sessions last about an hour. Sometimes I schedule clients to be seen for more than an hour, sometimes up to 2 hours, but that really is reserved for those couples who can endure longer conversations. Couples therapy can be draining, and what you don't want to have happen is for emotions to get so big that communication just falls apart. So, sessions lasting longer than about an hour, not usually a great idea. And then as far as who attends, for me at least, both partners attend at the same time most of the time, or in the same room or in the same telehealth video. So, yes, telehealth can be used with its pros and its cons. It's popular and it's effective. There is a video also in the links below where I have a conversation with Dr. Mike Griffin where I talk about just that, the pros and the cons of telehealth for mental health and relationship counseling. Now, there are times when I meet individually with each partner, and this can help each partner and myself to understand things like early childhood and past dynamics and the effect they have on current relationship dynamics. Or it can help each partner to understand sort of their role in unproductive in session dynamics. So I'll use these one off meetings to discuss topics that become too heated or too big to meet with the couple together. That doesn't happen very often. Usually I meet with each partner at the same time. So what exactly do couples therapy sessions look like? Well, this depends on the style of the therapist. So most of the time, for me at least, couples counseling sessions look like a conversation. The therapist should ask a lot of questions because they need to understand the apparent and the not so apparent challenges that each couple's experiencing. So some therapists use guided conversations. So the couple would be asked to maybe discuss a topic and the therapist would intervene to correct things like problematic language or just terrible tone of voice or body language that sends the wrong message. Or they'll correct other ineffective attempts to communicate. Other therapists might be more active in the conversation, sort of co-creating these new understandings and perspectives for the couple or with the couple. Other therapists may use more active techniques like role plays, or they may ask the couple to take turns speaking and take turns listening. One thing the therapist needs to ensure, though, is that the therapy room is a place where really difficult topics can be discussed without hostility, without demeaning comments, without invalidating each other, or with negative patterns that have already proven to be of zero value in the relationship. In my own work with couples, I tend to act as much like a consultant as I do a therapist. So I tend to offer a lot of thoughts, a lot of opinions. I draw a great deal on the research and on my experience to provide you with the information you need to create meaningful change in your relationship. So if I see you doing something that research or my experience has shown to be ineffective, I'm just going to tell you. I tend to be more directive, more straightforward, and very transparent. So in my work with couples, they don't usually have to guess what I'm thinking. I'm usually going to say it. And while I take my work very seriously, I also recognize that the right kind of humor can make a big difference when topics get heavy. Many couples are relieved to know that I don't do role plays and I don't do in-session activities and I don't ask that you hug before you leave each session. And if you're really hoping, as many couples do, that you won't be asked to do role plays or in-session activities, be sure to ask your therapist before you start working with them if they use those tools when they work with couples. God, I hate role plays.